Welcome to Dental XP. I'm Andrea Agnini, and it's a real pleasure and an honor for Alessandro, myself, and our partners Luca and Matteo Dondi being here once again in this amazing website, and for this special occasion that is the World Cup Team Dentistry. So we would like to thank the American Academy of Cosmetic Dentistry and Dr. Maurice Salama for the invitation of being here. We always work as a team, and the topic that has been assigned to us was like complex case restorations in the light of the new technologies. So what we are going to see today is exactly how the new technologies entered in the clinical and technical workflows, and we will see and we will try to explain to you how those technologies changed our way of thinking and our way of work. As I was telling you before, it's really an honor for us being part of this amazing group. You can see Team USA with Dr. Dennis Tarno, Dr. Stephen Chu, Team Brazil with Christian Kochman and Marcelo Calamita, Team Israel, Team Ukraine. So for us, it's really a pleasure being here today and being involved in this really special occasion. And I think that the nice thing of this was like to understand that nowadays working as a team is mandatory. In order to be successful, it's really critical to starting from the really beginning to share all the information that the patient is giving us with our technicians and with our co-workers. Only in this way we could achieve nice result for us and for the patient. We are from Modena. Alessandra and myself, we work in Modena. We are born in Modena, and it's our hometown that is famous worldwide for the Ferrari's factory that is really close by. It's like 5 kilometers from the city center. And Luca and Matteo Dondi are from Bologna, that is a really nice town, 40 kilometers outside Modena. And here you can see the two different views of downtown, daytime in Modena and nighttime in Bologna. And of course Bologna is very well known in the area for the food. So if by any chance you are passing by Italy and you're stopping by Modena or Bologna, please feel free to shoot us an email and we will be happy to show to you all these different places. We would like to invite all of you to the second Dental XP Global Symposium that is going to be held in Miami this upcoming June from the 18th to the 21st. And I really recommend you this Congress because all the experts of the world are going to be part of it. And it's not going to be only a scientific congress, but we're going to have also a lot of fun. We're going to be in Miami, and Hedi Salama and all the Dental XP staff that we would like to thank for helping us for this webinar. So thanks to Mr. Tyler Binner, to Pana, and to all the Dental XP crew that is working behind the scene. It's really important for us being part of this amazing website, and we're really looking forward to share time and our experience in Miami all together. So if you still didn't do it, I really recommend you to book your flight and to register to this conference. So as I was telling to you before, what we're going to see today is like a step-by-step case presentation in where we are going to share with you our protocol in complex cases that is basically divided in three main parts. The first part is what we call a preliminary treatment plan, in where we collect all the information, in where we are trying to achieve and share with our technician the information that are necessary to to arrive and to define a diagnosis for our patient, and then once we are going to be once we have a correct diagnosis, we are going to brainstorm all together with our coworkers, with our dental technician, in order to plan a treatment for our patient to arrive at the correct and satisfactory final restoration. So nowadays, most of the time, these kind of patients are entering in our office, and they are really asking ourselves to help them. They are what we call potentially a dentulous patient, that are patients that they still have their own teeth, but they are going to lose their teeth in a way or in another pretty soon, and they are all very scared about one thing. They are scared about wearing, even for like one day, even for like 1 week, a partial removable denture or a full denture. So this is why they arrive at this stage of their mouth, because probably a lot of time when they went to see some other dentist, they proposed to them to wear even for like 1 month, 3 months, a removable prosthesis, and all the time they refuse to do that because they really don't want that. And what we try to have is a protocol that is trying to fulfill the patient request in order to increase the quality of the life of the patient also during the treatment, not only at the end of the treatment plan sequence. And in order to do that, it has to be one person that has to be in charge of guiding all the branches of dentistry, in sequence, and always having in mind that in the middle of the treatment plan that it has to be the patient, because what we call nowadays modern treatment plan approach is based on clinician goals that of course are the classic ones, so surgicals, prosthetic and ergonomic goals, but most important, we have some patient goal, and as I was telling to you before, it's important for us clinician to increase the quality of the life of the patient, not only at the end with the rehabilitation of function and aesthetics, with nice and functional prosthesis, but also to increase the quality of the life during the treatment. And this can be done thanks to effective provisional and thanks to reduced surgical steps that are, of course, guiding to reduce overall treatment time. So this is what we always try to give to our patient, and this is exactly what they ask us. So having in mind the patient request, it's the starting point from where everything starts. On the Dental XP website, you can find and download these two articles that we published in 2013, one on the clinical implant dentistry and related research, and one in international quintessence, in where we are basically describing what is the prosthetic protocol that we are following, that is guiding us in order to restore these very complex cases. And this prosthetic protocol is called one model technique, and has been described for the first time in 2009 by Lonello Biscoro, that is right now the current president of the Italian Academy of Prosthetic Dentistry, and his team. We worked together with Team Atlanta, Maurice and Henry Sarama, Professor Stapper from University of Maryland, and our good friend Davide Romeo. So this is our today's patient. His name is Armando, 66 years old. He entered in our office for the first time in May of 2011, and his chief complaint was an high mobility of the upper jaw prosthesis, that it was like basically creating him a lot of problem also for eating, for example. He was of course not satisfied with the static of his mind, but his main point was like more a functional problem. And his attitude was positive, he was receptive and cooperating, but what he asked us in the same time, in the first moment when he entered in our office, was, please, I really do not want to wear anything removable. And that was his biggest fear. So what we have to do right now is to start collecting information, having in mind what is asking us our patient, and trying to fulfill his request. And as we do in all the cases that we start documenting the cases with the photographic set, and we start from the facial analysis, that is the real starting point, from where we saw that there was a canting of the midline and of the occlusal plane, and we are starting to drawing two important lines that are the two reference lines that are guiding us in our facial analysis, that Christian Coachman defined the cross in his digital smile design program. So we are passing from a macroaesthetic analysis to a mini aesthetic to a microaesthetics, and from here we collect information. We saw already the canting of the dental midline, the canting of the occlusal plane. In the mini aesthetic analysis, so in the dentolabial analysis, we can see that we have like really wide buccal corridors. We can already see that the dental proportion are off. In the microaesthetics pictures, going more inside the mouth of the patient, we can see the typical signs of the periodontal disease. We can see that the teeth are migrating, they are extruding, we have like some diastema in between the teeth, the gingival symmetries are completely off, we have like a tooth malposition. So we have a lot of information that already from these three pictures are available to us, and from this starting point we have to start sharing our information to our dental technician by filling up an aesthetic and functional chart that is going to be sent together with the study models and with the picture to our lab. We can keeping on going in our photographic set, and we can see that from this dentolabial analysis, but this interdental picture from this interdental smile line, we can see again that the upper jaw is migrating and is all vestibularized, especially the incisors, and are extruding. And we can see on the right picture, thanks to the digital smile design from Christian Coachman and Livio Shinaga, we can start speaking also with the patient, communicating with him and diagnose him, helping him to understand what we would like to do with him and what we can also do with him. So this is really important for us to communicate with the patient, that he gets this visual impact that is really important and is really really much easier for the patient to understand us while we are speaking in front of some pictures like this one, instead of like just only speaking and trying to let him understand what we really would like to do. So you can see here that the dental proportion are off, the occlusal plane is completely off, gingival symmetry are not correct, and we can start planning what is possible to be done in Armando's mouth, and we can start speaking with him what we should do in his mouth, in order also to have him accepting what we are proposing to him. And keeping on going in the intraoral analysis, we can see from these lateral pictures this teeth malposition, these functional problems, functional issues that Armando was presenting in the first visit, these pre-contacts. And of course, in the first visit, it is important to collect also this data, this functional data, because yes, he came for solving the problem of his upper jaw, but it's clear that if we don't take the mouth in consideration at 360 degrees, we won't be successful, because as Porel in 2012 in this article is telling us, one of the major risk factors, primary factors in full arch rehabilitation of failure is the opposing natural dentition. So we have to think that yes, we have to speak about aesthetics to the patient, but most importantly, we have to speak about function, and we have to restore the function. And when we see situations such as this one of Armando in the lower jaw, we have to start taking in consideration also to restore, together with the upper jaw, the lower jaw, and having our patient understand why we are giving him all this complex treatment plan. So this is really important, and it has to be done first visit, collecting the functional information, seeing if there are any pre-contacts, starting to speaking to the patient also about these possibilities. Then of course we have to complete our preliminary treatment plan with a full mouth x-rays, in where you can appreciate the periodontal problem of Armando. You can see also in the periodontal chart that has to be done before and after the hygiene sessions. We start to collect all of this information together with study models, and we are sharing also this information to our dental technician, so he can start thinking of what we can propose to Armando. CT scan evaluation is important to evaluate the bone quantity, especially in the upper jaw. And what we saw in this particular patient is that luckily for him, he had enough bone quantity to having done in his mouth 6 implants in axial position, not tilted. So, and for this particular patient, we decided to rehabilitate him following the Teeth Express solution from BioHorizon. And so we arrive at the fulcrum of our treatment plan, the really starting point of the final phase, that is the critical analysis and the diagnosis of Armando's mouth. And what we saw so far is that we have a 63 years old patient with high need of functional rehabilitation. We have in front a thick biotype with advanced chronic generalized periodontitis in the upper arch and a moderated parodontitis in the lower arch. We have sufficient bone quantity in the posterior upper arch to place at least 6 implants with the Teeth Express solution. We have an average smile line, and most importantly, we put it at the last point of this list, but it has always to be at the first point, that we have to have in mind the patient request, and the patient refuse any kind of removable prosthesis, and we have to try to give him what he asks us and to fulfill his request. Here is presented what we planned For Armando, in the upper arch, screw retained zirconia oxide restoration on 6 action implants following the Teeth Express concept, and in the lower arch, orthodontic treatment and implant restoration on tooth number 46. As for the upper arch, we decided to go for a monolithic hybrid zirconia restoration hybrid because we decided to have a 0.6 of ceramic layering, of feldspathic ceramic layering in the 6 front teeth, in order to give and to permit to Luca to characterize at its best the anterior area, in order to deliver to Armando a better aesthetic solution. And in the lower arch, we decided to perform an orthodontic treatment because, as we saw also before, what is important is, and what is the primary factor, is to restore and to reestablish a proper function to the patient. Because in cases such as this, if we want that this big rehabilitation stays in the mouth, and if we want to have long-term survival rates in this big complex rehabilitation, we need to focus on the function parameters. We need to focus not only in one of the two arches, but we need to reestablish the mouth in looking at 360 degrees. The protocol that we always follows is to try to give a first provisional on natural dentition to our patient. This of course is Armando when we remove for the first time all the rehabilitation. And as you can see, what we always try to do is to eliminate the teeth that are completely unuseful, and to try to keep like 3 or 4 abutments that are going to help us in placing a first provisional on natural dentition, in order to try to eliminate some bacteria and to reestablish a correct soft tissues health. As you can see from this picture, for example, we kept in the upper arch 3 abutments that are going to be extract at the day of the surgery. But look at the soft tissue right now. It's much easier for the surgeon, and it's much easier for having a correct approach, correct surgical approach with this kind of soft tissue, rather than the soft tissue at the beginning of the therapy. And of course, it's very important to plan carefully also the first temporary, because with it we start to improve the aesthetics and the function of our patient, and at the same time we are meeting with the request of Armando that he didn't want, and he was refusing anything removable. And in this case, we managed to place this first temporary on 3 dental abutments. And from here you can see, with the comparison of the of the old restoration of Armando, that we managed to start working on the dental proportion, start working on the buccal corridor, start working on the white and pink aesthetic balance that we know that is very important for the aesthetics in the mouth of the patient. And by doing this, we manage also to increase the quality of the life of the patient during the treatment plan. So, and you can see Armando in our facial analysis that is also immediately more happy if we compare him with his old restoration. And yes, aesthetics is important, but also function is important. So already with the first temporary, we start to increase and to improving the overjet and the overbite of Armando. And as I was telling to you before, our protocol is defined one model technique, that has been described for the first time by Leonello Biscor and his team in 2009, is made of 3 phases: a pre-surgical phases, a surgical prosthetic phases, and a final phase. And in the pre-surgical phase, that is a clinical and that is based on clinical and technical steps, we collect all the information that we can in order to give to our lab technician something from something that he can work with when he's building the immediate temporization on implants. So for doing this, we do an aesthetic train prior to surgery, in where we keeping on evaluating all the aspects of the mouth of Armando. We are working with the orthodontist in the lower arch. We are reestablishing the proper function of our patient, and we are keeping on collecting data that are going to be very, very, very useful immediately after the surgery to build the immediate rehabilitation. Then from that aesthetic train it has been built a surgical stent and a transfer plate that is going to be used during the surgery to transfer the implant position to the lab technician. We tried it in the mouth. Here notice a particular moment of the surgery with the surgical stent in place and 2 implants in position, and it's critical to have the surgery prosthetically guided. The implant has to stay inside the prosthetic volume that has been studied before doing the surgery with the static try-in. In fact, remember that the surgical stent derives from the static try-in that it has been done in Armando's mouth. During the surgery that we perform, following the Teeth Express concept based on 6 axial implants in lateral and bicuspid position, we try to avoid to elevate big flaps, reducing then the trauma and giving to Armando a better follow-ups without swelling, without pain, and meeting the request of the modern treatment plan approach of reducing the surgical steps, decreasing the overall treatment time of the patient, and of course having a patient that does not have pain and does not have swellings makes him happier and improve his quality of the life during the treatment plan sequence. What we use here are tapered internal plus implant by Horizon. We are in the second phase of the one model technique, that is a surgical and prosthetic phase. When the surgery is completed, we start placing the prosthetic components. In this case, we use straight multi-unit abutment that are torqued down in the implants, and that from this moment are not going to be unscrewed anymore. We use this kind of implant that have this particular technology, that is the laser lock technology described by Myron Evans and his team in 2012 in the International Journal of Periodontics and Restorative Dentistry. This laser lock technology, that is a copyright from BioHorizon, seems to improve the connective tissue attachment to the implant surface, and especially to this laser lock surface, increasing the seal of the soft tissue to the implants. And so all these little details are making the difference at the end of the treatment plan, because what we want, as we were discussing also before, is something that stays in the mouth of the patient, that has a long-term survival rate. So that is why from the surgical step to the prosthetic step, everything has to be carefully studied before. We should use always implant and prosthetic components, high quality implants, high quality prosthetic components, in order to be more performing. Here is the prosthetic phase of the one model technique sequence. You can see that we always position a rubber dam in order to avoid the pattern resin, in this case, to enter inside the sockets immediately after the surgery, because we use the pattern resin when we place in position the surgical stent that right now is becoming the transfer plate that is going to transfer the implant position to our lab. And you can see here the transfer plate with the pattern resin that is being taken out from the mouth of the patient, and Laura Morselli, one of our dental technicians, is placing inside the model that is the same model that we utilize for building the first temporary, is placing in the model in where she removed the stone, is placing the transfer plate, and once the transfer plate is in position, she's going to place again the stone and to fix this transfer plate in position on the model. Once she did that, she can start working on the metal reinforcement of the provisional restoration. This is what our protocol needs, because what we saw is that the most frequent complication reported by the studies in the literature was the fracture of the acrylic prosthesis, and so it's obvious that the metal reinforcement is significantly stronger than all acrylic resin framework, because they provide increased rigidity. Once she did that, always helping herself with silicone putty index, she can start building the provisional restoration to the patient, focusing on also the aesthetic characterization. You can see here all the layering of the enamel, the dentil and enamel layering, because what we want to give to Armando is a nice and effective provisional that can work in his mouth. Once the provisional restoration is ready, we recall the patient, and usually this happens like 24 hours after the surgery. We will see in this particular slide the protocol that we use when we deliver the immediate temporization. You can see we remove the healing abutment. This is not Armando, but is another patient, but the protocol doesn't change. We remove the healing caps, we remove the suture, we trying the upper and the lower provisional, we try the function, as you can see down here. But what I want you to focus on in this slide is on the face of the patient, that you can see there is no swelling, she did not have any pain, and she's happy with this provisional restoration. This is fulfilling the protocol of the modern treatment plan approach by increasing the quality of the life of the patient. Here the provisional of Armando in the lab, and on the left side the provisional of Armando in place. You can see Laura work with white and pink in order to improve the dental proportion, to improve the gingival symmetries, to give an effective provisional both from an aesthetic point of view but also from a functional point of view. You can see on the right side that right now the balance, if we compare it to the initial situation, is much better, the white and the pink balance, and Armando is much happier than the beginning with his temporary in place. And you can see also in Armando, no pain, no swelling, no bruises. So this is why we try to avoid to elevate big flaps. This is why we try to have only one surgical steps. And also we met Armando's request not to having him wearing a removable prosthesis even for 1 day. This is the soft tissue situation at 3 months when we first unscrew the provisional, and from now on starts the third phase, the first phase of the one model technique, that is the finalization of the case. We of course check with a combined CT scan the implant in place, so how they are working in the bone, and we start collecting information that are going to be sent to the lab in order to start working on the final restoration. Here on this slide you can see on the left side the model with the transfer plate in position that you already seen in during the surgical steps, and on the right side what we gave to Luca, that is basically the soft tissue impression that has been taken inside the patient's mouth after 3 or 4 months after 3 months from the surgery, that we know that the tissue is going to shrink, and since we are working on the same model from the really beginning, and that's the peculiar of the one model technique, we have the possibility to only put some glue on the provisional, on the immediate provisional restoration, and just by placing some imprengum in the space between the tissue and the provisional, we can take this soft tissue impression that we're going to send to Luca. And in this moment starts the final restoration workflow, is where the technician and the technical workflow are giving the final imprinting to Armando's rehabilitation. And discussing with Luca is always fascinating on how important in this big rehabilitation have the team approach, how important are the care of the provisional, of the first provisional natural dentition, on the details that and all the effort that we put in building the provisional on the immediate on implants. So how important is to put extreme attention in every single details of the immediate provisional restoration, because from that is really the starting point from where all this final process starts. Because once we discussed with the patient and he accepted under the point of view of the comfort and aesthetics, and also of course function, that is one of the primary factors, there's a provisional restoration. Lucas starts building in wax on the model a prosthodontic project that is going to then be the base for a prototype that we're going to try in the mouth of the patient. So Luca basically right now is once he collected all the information that we gave him from the really beginning of the case, is putting his knowledge at the service of the patient, and is designing in wax this prosthodontic project that is really the fulcrum of the final rehabilitation. From this is going to be produced a prototype try-in that we're going to try in the mouth of the patient, and we're going to see if there are some minimal changes that we have to do in this project. And in this case, while we are evaluating the facial analysis, that is always the picture where you have to start evaluating this prototype, we saw that there was like a problem on an actual problem of tooth number 21, and looking at the left buccal corridor of the patient, it was a little bit too wide compared to the right side of the patient. So what Luca basically did was taking picture of this, discussing with the patient, discussing with us, so involving also the patient inside the treatment plan process, asking him what he was thinking about this prototype, and then going back to his lab and working on the modification that we discussed together with the patient and with our team. And you can see here in this picture Luca using a white wax to modify, as we were discussing, the axis of tooth number 21, and trying to vestibularize all the left side of the patient in order to decrease the width of this buccal corridor. And this point is really important because it's where tradition and innovation are blending together, because right now the problem is to trying to duplicate all the information that we have collected so far and that Luca modified in this walks-up analysis, and to go for the final rehabilitation. So let's see now how the new technologies are entering in the clinical, but especially in the technical workflow, and what are the advantages and the benefits that it's giving, that digital dentistry and new technologies are giving to us in this particular era. So thanks to the ZFX Evolution, which is a new fully automated optical scanner whose measurements is based on the principle of the strip light projection, it was possible for Luca to scan the prosthodontic project and the implant position. We will see that implants abutment and soft tissue tunnels were recorded as well with specific match holder for the technical workflow. What is important is that we have a device that is torquing down the match holders at the same torque. So you see again the attention in every single details, also in this digital part. This scanner, the Evolution, has the highest possible scanning accuracy of less than 9 micron per solid, and in this way the models digitized by the new scanner provide the perfect basis for the construction of extremely complex geometries such as implant supported screw-retained bridge frameworks, exactly what Armando needs. Maximum precision is achieved through a fully automated calibration of the device with every scan, as well as by the combination of an established measurements method with high-tech cameras that are working with a LED light source. The swiveling and the rotating positioning unit inside the scanner on which the model is placed guarantees a precise detection of all these entire details. And another thing that is interesting is that you can work with different articulator. The Evolution has inside the software the possibility of choosing to which articulator work with, so it gives like plenty of possibilities to Luca and to Matteo and to their team to start digitalizing this final rehabilitation. And from this moment starts the real digital workflow for first putting in the Evolution the complete model that has to be scanned, and then doing this scan that is the most important one with the match holder in place, because the Evolution right now is transferring and copying the position of the implant in the software. For doing this, it's very important to use these match holders that are placed that are torqued down with a specific device that is a dynamometric keys that permits Luca to torque the match holder down at the same torque one to another. Then we're going is going to scan his prosthodontic project. So here is where the tradition is blending inside the innovation, because all the effort that has been put it inside this prosthodontic project since the really beginning of the treatment plan are right now copied inside the software of the evolution with you can see here the two LED lights that are the base of the evolution system, and that are transferring in digital all the information that Luca, but also us and our team achieved from the really beginning of the treatment plan to build this prosthodontic project. And last but not least, another scan that has to be important to be done is the one of the parts of the part of this project that are touching the mucosa. So not the occlusal path, not the occlusal volume, but exactly what of this prosthodontic project is touching the mucosa of Armando's mouth. So you can see that, of course, the position of this final scan is not the same of the first two scans, and that's why these steps that you are now watching is critical and is mandatory to have something that makes sense inside our software. Right now, basically, Luca is matching the previous scannerization that has been done by the evolution by simply taking 3 points that are clear points that are present in all the scan, and you can see here in this case Luca that is choosing the points, and then we will see that the software is going to match with different colors all the previous scans, and we will have a final product from where like the software and Luca are going to work to this CAD to design the final framework. And here you can see here now we have the meshed of all the previous scan, and from this moment on, thanks to the software, thanks to the wizard that is always helping the operator on the right side of the screen, Luca and Matteo are going to design the framework, having all the information digitalized. So all the work that has been done from the time that Armando entered in our clinic are right now inside the computer screen of Luca and Matteo Dondi, and they are going to put their traditional knowledge at the service of the digital technology, at the service of the patient. So in order to summarize this evolution scans workflow, what we need to have is to scan the complete model first of all, then scan the model with the mesh holder in place, and as I was telling to you before, it's very important to use this dynamometric key in order to torque the mesh holder down at the same torque. Scan the model with the prosthodontic project, so the definitive wax-up that is exactly the prosthodontic project, and then scanning also the mucosal part of this wax-up, and then we will see that like on this top, on the picture on the right, we're gonna have the matching of all the previous scan, and this is exactly what we have. You see we have the mesh holder, we have the prosthodontic project, and we are like rotating in the software this scannerization. And here you can see the software workflow that is the result of what we did so far. This is exactly what was the prosthodontic project in wax, reproduced, digitalized, and from here Luca can put together with Matteo their knowledge at Armando's service, using all the benefits that the digital solution are giving to them, being in this way more precise. And you can see that here on the left side we have the plane structure from where they're going to reduce from here, achieving the final framework design, and the framework design that Luca and Matteo are using and that they created is called ZIL, zirconium side laminate, that has been published in 2013 in International Quintessence. The concept of this framework design is to utilize the characteristic of the zirconia, so using its positive characteristic to our own advantages, to our own advantage. And you can see here that they're trying with this peculiar shape of the incisor framework to bringing in the so-called weak areas of the incisal margin, for example of the central incisor and the lateral incisor, the zirconia as much as they can in order to increase the strength of the final work. And this work has been reduced for 0.6 millimeter all around in order to give with a really thin layer of ceramic the correct characterization in order to give to Armando a better aesthetics and a better characterized final rehabilitation. And here you can see the final framework that has been designed by Luca and Matteo following their zirconium side laminate concept. Here you have an occlusal view with on the left side, of course, still the digital project, so the CAD project with all the screw axes in place with the reduction of 0.6 millimeter all around, with all the occlusal path that has been studied carefully during the prosthodontic project phase. And on the right side you can see the CAM part, so what is the final product that is coming outside the milling center and is being sent to Luca's lab. You can see that everything is really precise, but in order to obtain this precision, every step has to be carefully guided, as every step has to be carefully tested before. And of course, working with high level and with high performance machine like the ZFX Evolution Scanner, it's critical for the final restoration success. Here you see again, once again, what has been produced by the milling center on top of the study model. Here we have the first layering of ceramic that is called liner, that Luca really likes, and which permits to give him a first characterization of the work. And what Luca likes about this material, about this liner, is that creates a very good adhesion from the zirconia to the layering ceramics. And of course, working with the digital solution permits to Luca to be more precise and knowing exactly how much has been reduced. And in this case, he knows that he reduced 0.6 millimeter all around, and so knowing this for sure, so having the 100% percentage of being sure that it has been reduced 0.6 millimeter with only 2 bakes, is able to going to finish the work, so also reducing the bakings and increasing the precision. So again, the digital solution are giving us benefits and are giving to our patient advantages for their final restoration. And once again, here we have the plane structure that has been planned digitally, and you can see on the right side the final restoration. You can see how precise we can be nowadays with these kind of technologies. And if everything is being used in the correct way, if the traditional knowledge of our technician, if the traditional knowledge of the clinician has been put at the service of these digital technologies, we can really achieve great results such as this one. And then we can deliver the final restoration to Armando. We can see here how we manage to change Armando's mouth from time 0 to the day of the final delivery. We can see the amazing work of Luca and Matteo and their team, how they managed to work with the white but also with the pink dimension, how the pink dimension is helping them to recreate the tooth proportion, the teeth proportion, the gingival symmetries, the teeth axis that at the beginning were completely off, how the occlusal plane and also the function of Armando has been completely recreated thanks to the orthodontic treatment. And if we want this kind of work to last in the mouth of the patient, to have a long-term survival rate of this kind of big rehabilitation, this is exactly what we need to have. We need to have a control of the static, so a completely reestablishment of the occlusal path, but and also in order to have an happy patient we have to give some aesthetics, we have to give the and permits our technician to characterize with their artistic skills the final restoration. And remember that everything is important, so every single detail is important. We need to have the correct spaces for the hygiene, because remember that underneath this upper jaw we have like 6 axial bi-horizon implants that has been placed, and they need to be cleaned by the patient, and the patient has to have the possibility to clean in an easy way the prosthesis. And so all the details once again are working together for the long-term survival rate of this final rehabilitation. And we can see here, of course, the immediate protocol and the Teeth Express solution is giving us and our patient a great advantage to solve these kind of cases that are very complicated in a relatively short amount of time. In this case, the overall treatment time lasts for 12 months, because of course we had also the orthodontic treatment time to address. And but you can see that from time zero to the final rehabilitation we have a lot of work behind the scene that in our opinion is has the same importance as the final result. So collecting all the information, putting extreme attention to every single step, every single procedure that bring Armando to time zero, to the cementation day of his final restoration. Every single step is really important for the final success. And of course we can see that, and we showed to you how and where the digital solution are entering this protocol, and how big are the advantages, and how big will be the advantages that this new technology are going to give us and are going to give to our patient in the future. And of course right now we have some picture of the facial analysis of Armando with the final restoration in place. You see from different angulation. It's always important to have this kind of picture, but it's always important to evaluate the patient also in a dynamic movement. So always remember to take not only picture but also videos at the beginning and at the end of the treatment plan, because the dynamic movements are giving you a lot of information that you can use and you can share with your technicians and with your team. And of course 1 year follow-up, the CT scan and the panoramic X-ray, that is telling us that the 6 axial implant that we placed in Armando's mouth are doing their job, are in good shape, and everybody is happy when we have results such as this one. So in order to summarize, the benefits of the digital solution is that, as we discussed also before. We can save time during the clinical and technical workflows, and of course we have the possibility to duplicate the prosthodontic project into the final restoration. Into the final restoration. These, of course, are important benefits that the new technologies are giving to us, and we have also the possibility of having a database. So we are not losing any data, but we are always going to have something in a folder of the softwares that is going to tell us what we did for that kind of patient, and we are not going to lose, and there are not going to be any shrinkage of the impression material, but because everything is going to be recorded and is going to be kept in that is going to be kept, sorry, in that folder. Of course, we have still some limitation. We have to understand how to use the software. Of course, it's time consuming, especially at the beginning, back because there is an initial learning curve that is mandatory, because if not, it's impossible to use this kind of software. And of course, we have to work in a team, and we have to work with somebody that knows how to gain advantages and gain benefits from these new technologies, from this new material, from these new procedures. That's the real key. And trying to tie it up this presentation, let's try to give you some take-home message. Of course, we saw that the new technologies are an amazing tool, but remember that are just a tool, in the sense that they permit to simplify our workflows, our procedures, but what we have to know is that standardized protocols are still the key for success. Professional backgrounds are still the key for success, and they have to be combined with the new technologies in order to provide better aesthetics and functional results. But you have professional backgrounds, you have to have professional backgrounds, you have to know in depth the material and their properties, you have to perform carefully every single clinical procedures, and with digital dentistry, one of the most important thing is that you have to be constantly up to date, because every day more they are keeping improving, and every day there is something new that you have to try, that you have to learn how to use, and to learn how to put and to put in your practice. So this is really important, and in order to really conclude, we want to present this final case. Again, complex case rehabilitation of this patient that was suffering of a chronic periodontitis, that he was going to lose all his upper and lower teeth, and we did something peculiar for this patient. In fact, we treated him in the upper arch with a traditional protocol, the one that you saw today, of the one model technique. We try to be as minimally invasive as possible by not releasing any flap on 6 axial implant, post-extractive implants, working with the transfer plate, working with the one model technique. And what we did in the lower jaw was, yes, working with the same protocol, but putting also the new technologies inside this protocol, and by using the intraoral scanner and scanning underneath and scanning, sorry, the lower arch, the lower transfer plate with the mesh holder in place, in order to give all the information to the dental technician that could have built, in this case, the final restoration. And we're going to see that in this slide we're going to see that we have a final provisional restoration, that on top is a metal reinforced acrylic resin, and in the lower arch has been built a provisional restoration in PMMA. Thanks to the new digital possibilities, we built this provisional restoration thanks to the intraoral scanner information, and we managed to save some steps, and we managed to save time in this innovative protocol that we are trying to perform for this patient. And of course it's to be continued, because we have to keep collecting data, we have to keep like working, and we have to keep on working in our learning curve, because as I was telling to you before, we have to be constantly up to date, and we have to increasing and improving our knowledge on these new technologies. So we would like to thank all of you for your attention. We would like to thank our team, Luca and Matteo, and their team for their work. And we would like to thank you again, and we will see you, and we hope to see you, all of you, in Miami in June. It's going to be an amazing week. Thank you very much.